Carol
This
Thayer, Vice
conference
Chair.
will now be recorded.
Carol Thayer, Vice Chair. I'm going to call the meeting to order. It is, according to my watch, 10:07 a.m. on May 5th. Pursuant to Governor Baker's March 12th, 2020 order suspending certain provisions of the open meeting law, General Laws, Chapter 30A, Paragraph 18, and the Governor's March 15th, 2020 order imposing strict limitations on the number of people that may gather in one place. This meeting of the Harwich Council on Aging Board of Directors is being conducted via remote participation. No in-person attendance of members of the public will be permitted, but every effort will be made to ensure the public can adequately access the proceedings as provided for in the order. Okay. First order of business would be approval of the minutes. Do I have a motion? The minutes, these are the minutes from the meeting of April 7th. Is there a motion?
Motion.
Okay, all those in favor?
Aye.
Aye. The motion is approved.
I'm sorry, I didn't catch who seconded that.
I'll
second it, Ralph.
Seconded, okay, awesome,
Oh,
thank
Ralph,
you.
okay.
Was it Jim?
Go
I
ahead.
heard a couple at the same time, so I just made a notation for Ralph.
Okay.
Thank you.
Okay. Are there any members of the public out there? Are any members, no members are online that I can see or hear?
I don't see anyone, and no one emailed me in advance.
Yeah, okay. Then I guess public
That doesn't
comment will have to go by the board. Chair's comments. I'm going from the agenda. Check in with the members. Anybody have anything they'd like to talk about?
All right.
I've got one thing. I just want to say congratulations again for an absolutely splendid newsletter. I mean, it was just
Great.
so much information in there. I had to read it twice.
Thank you.
Great, Emily. Great. All right, Elder Services. Anybody got any report on that? I'm in the dark on that one. I missed last month's meeting, so.
I can speak really briefly to that. I know Richard is coordinating or helping to coordinate a program with kind of a regional task force, and he'll be speaking at a program on June 15th. I don't know if any of the details are finalized. He had wanted to mention it. So if he joins us, I'm sure he can provide more details on that. But that agenda item was in reference to a specific event that he'll be speaking at on June 15th.
Okay. Okay, then I guess we're on to you, Emily.
Okay, thank you. I have a lengthy report today. I'll do my very best to be as concise as possible, so bear with me. I'm very excited with our vaccine updates. I think as I'd reported last month, we were above 90% for our Harwich residents age 75 plus. We're now over 95%. And that's kind of the threshold that they calculate it at. They won't get more specific than that in terms of percentages. So we're in the very highest threshold for folks age 75 plus. And I think we're in the 85 to 90% vaccination rate for folks age 65 plus. So it's just been phenomenal. On January 27th, when they announced that people age 75 plus would be eligible, I couldn't imagine that we would be where we are today. It's certainly been a labor of love by a lot of people at a lot of levels. And so I'm very thankful for the progress that we've made in town, across the Cape, across the state, across the country. It's really phenomenal progress. There have been a couple of changes to the vaccine process. So for anyone who is still in need of a vaccine and maybe watching this, or who you might be in contact with in your private or professional lives, Barnstable County is no longer announcing clinics in advance. They've become part of the state's pre-registration model. So if you pre-register with that vaccine sign-up website that I included in your packet, it's vaccinesignup.mass.gov. You can pre-register, and then you'll receive periodic updates about your status on the pre-registration list and when an appointment might become available for you. I know people have been contacted very quickly after pre-registering, so it does include the Barnstable County sites, it includes the mass vaccination sites, and I'm sure other regional collaboratives are part of the pre-registration process as well. So that's been a notable change since we last spoke. And I'll just say that vaccines have become markedly more available, especially at our retail pharmacies. I know CVS and Stop and Shop and Walgreens have all had significantly enhanced availability. You might check their website and find appointments available for today or tomorrow. So it's really a dramatic improvement in vaccine access, particularly at the local level. In terms of our COA role, we did do a second round, help coordinate a second round of homebound vaccinations. We were down to just 8 people who needed assistance for that second round. As we were coordinating that, it was in the midst of the pause in the Johnson & Johnson vaccine. So folks on that list received the Moderna and therefore will need a second shot. That second shot is scheduled for May 20th, so not next week, the following week. And that was again done with EMS and in partnership with Outer Cape Health and the health department as well. So we're very happy to do that. We are still taking names of people who are in need of a homebound vaccination, but we're not getting a lot of contact from people who are still in need of that service. The other change for the Cape Cod Healthcare site, they had, Cape Cod Healthcare was coordinating appointments at Cape Cod Community College, and they were allowing towns to provide priority lists. We were able to assist about 300 people through that priority list sign-up process, and the demand for that has decreased dramatically, both in Harwich and across the Cape. So Cape Cod Healthcare has transitioned to just opening those appointments to the general public. So they have both an online registration platform and a phone-based registration platform. So you have the state pre-registration model that also applies to the county. You have the Cape Cod Healthcare site. You have the retail pharmacies, and we still have access to assist our homebound residents. So tremendous progress with vaccination and just kind of a precipitous decline in demand. So we're getting a lot fewer phone calls, a lot fewer people reaching out with questions or fear or anxiety or needing assistance with second doses and things like that. So it's been tremendous. So I don't know if anyone has questions or feedback on the vaccine process.
Oh, I think it's been going fabulously well. I'm very, very impressed.
Excellent. All right, so I do have some staffing updates. As you know, we have been in the process of hiring a per diem town chef. Our full-time town chef, Linda St. Pierre, has been working tirelessly, particularly since the onset of the pandemic, and has been working really alone. So we're in the process of hiring some support for her, especially as she takes vacation or other time off. We do have one finalist who will be meeting with the town administrator tomorrow as kind of the final step in the interview process. And then I'm hopeful that his name will be presented before the Board of Selectmen for notification on Monday, May 10th at that meeting. So hopefully we are well underway. We've had to cancel lunches a few times when Linda was unavailable, and so we're very hopeful that hiring this per diem town chef will prevent us from having to cancel that service going forward. So I'll be able to share, his information at the next meeting, but I'm just excited to report that that process is near the final stage, which is great news for the department and for Linda.
Great, that's wonderful.
Yes. In perhaps less positive news, I know I have mentioned probably beginning in September, that I had been working on a staffing reorganization. When Susanna resigned as social services coordinator back in April of 2020, Julie Wiedis, our program specialist 1 at the time, was promoted to fill that position. The program specialist 1 position has therefore been vacant since her promotion in August. In September, I proposed to the town administrator a reorganization to change that program specialist 1 position to a program specialist 2. Those are both positions within the Harwich Employee Association Union. So it was sort of a unique opportunity where we could do a reorganization versus a reclassification. A reclassification would be if the position was filled and we were trying to bump it to a higher role, versus a reorganization where we would be making that change before recruiting a new employee. So when I had been meeting with Joe Powers, the town administrator, in September, October, November, we were talking through what that job description would look like, what the departmental needs are that higher rated position would be able to fill. And the concern at that time was budgeting. Of course, a higher position has a higher cost, as well as the fact that that union was in active negotiations to finalize a contract. So it was sort of on hold. When we were going through the budget process in December and January, I had discussions with Carol Coppola, our finance director. She supported me including the higher level of funding in my proposed budget for next year, for fiscal year 22. I was able to incorporate that higher dollar amount while complying with the directive to level fund. So we had kind of passed that budget hurdle, and then we were still waiting on negotiations to wrap up. Those negotiations were finalized in March, so just recently. So at that point, I began pursuing this reorganization more actively with administration. I'd had a meeting with Megan Eldridge, the assistant town administrator, to discuss it. She then proposed it back to the town administrator, and he's not supporting it at this time. So I won't be able to move forward with that. When I had the conversation with Megan, not with Joe himself, she said his priority at this point is some reorganizations in other departments, and so he wouldn't be able to consider this for at least 6 or 7 more months. So my options at this point are either to hire some temporary admin help, or to fill the program specialist 1 position and kind of taking that reorg off the table. So I'm not entirely sure what my plan is to do. I included our statement of departmental needs, the kind of memorandum I had presented to Joe to advocate for this position, the existing program specialist 1 job description, and my proposed program specialist 2 job description. I think if you read through those, you can see that it's a very significant difference between what a program specialist 1 and a program specialist 2 would offer to the department and would offer to seniors in our community. I think it's a significant loss to not be able to pursue this change at this time. If you haven't read through them all in detail, the program specialist 2 allows us to be more intentional in our programming and volunteer recruitment. It's a way to kind of more actively engage in getting feedback, providing oversight, providing training, offering evidence-based services that a lot of other councils on aging are doing, and I think we're not doing as well here in Harwich. So I am disappointed. I think this was a unique opportunity where the position was vacant and the funding was available, but it's kind of beyond my authority to change it at this point. So I will be making a decision shortly on whether to fill it with a temporary admin position or to just hire for a program specialist 1. But I know I've been talking about this for several months, so I just wanted to give you the update now that I had something substantive to share. So I don't know if anyone has any thoughts or feedback on that, or I can just move on.
I read the policy over, Emily, and your requested change. It made perfect sense to me. I'm sorry that the town administrator has put it on hold. I wonder if hiring temporary help. I'm wondering. I guess what I'm saying is, if you fill the program specialist 1 position, does that kind of hurt you in wanting to go forward with this reorganization? Would be my only thought. Perhaps temporary administrative help might be a safer way to go to show the need. Just a thought. I don't know how anyone else feels about it.
No, I agree with you, Carol. Yes.
I mean, it's certainly your decision, Emily, and your needs. You're the best one to identify your needs. So it's just my thought.
I think it's challenging. That's kind of where my heart lies as well. I think obviously having administrative help is critical, but I think having additional professional help from folks who are, have professional experience in aging services is what's going to move this department forward. My concern is that by pushing things forward, I'm not confident that anything would change in 6 or 7 months. So I was told by Megan that Joe would be willing to reconsider it at that point, not necessarily that he would support it. So that's my reluctance, I would guess. So I am really struggling with it, to be honest. I don't know what the best move is. So I'll certainly keep you updated, and I certainly appreciate your feedback as well.
Okay.
All right. On to current and anticipated operations. I apologize. I realized this morning that I missed a document in your packet, that kind of normal breakdown that I put of the scope of our current program. So I'll run through it verbally, and then I'll send that document to you by email after the fact as well. So we are still running our full scale of community-based programs. Our lunch program remains at a capacity of 70 meals per day. We currently have space to add people on every day of the week. We're hovering right around 65 to 67 at this point each day. So if anyone is still in need or newly in need of this service, I certainly encourage them to reach out to us. We'd be able to add them into this program quickly and smoothly. So we're happy to onboard new participants into that. We are kind of in tandem in light of public health trends and reopening at the state level, considering our own reopening plans in terms of on-site COA services. We recognize that we don't have the staff resources to operate both a full scale of community-based and a full scale of on-site services simultaneously. So we'll really need to scale back our community-based services in order to scale up our on-site services. So we're planning to send out our survey to our lunch participants. They would be the most impacted by this scale down, to kind of assess what the level of need is, what other resources and services they either have in place or could put in place to help mitigate the need if we do scale that program down, to see if maybe, if we can drop back our capacity to something smaller, so that we can reallocate some staff time and resources to on-site things. So we're in the process of doing that now. We'll be putting that survey out, if not this week, then next week, to actively solicit that feedback. So we may, in the very near future, be scaling that program back, but it remains at full scale now. Transportation remains at 2 riders per trip on either van, although vaccination rates and public health trends may allow us to scale that back up to at least maybe 3 or 4 people per trip. So I'm hopeful for that. Our grocery and pharmacy support remain in full effect, both in terms of transportation and delivering groceries and medications to folks at home, so no change there. Our remote programming through the Regional Council on Aging Collaborative has been tremendously successful. I think there were close to 30 programs offered for March and April. We have about 25 planned for May and June. We at the Harwich COA hosted one of them the last week of April that had about 60 participants with tremendous discussion and engagement, and from all across the Cape. So it's been a really wonderful collaborative. I'm hopeful that we'll continue this collaborative. Even as we return to more ordinary operations. It's removed a lot of the kind of town-specific barriers and expanded and broadened what programming and classes that people have access to. So I think it's been tremendously beneficial. I'm very excited about it. I'm glad that we're continuing it. So that's been a really positive thing. I want to mention for our on-site services, they're still limited right now to the one-on-one services with staff and professionals. Something I think is important to note that's come up as folks call us for those services, we are still asking the full scope of COVID screening questions to all on-site program participants, regardless of whether they've been vaccinated or not. So those questions include whether someone's come into contact with a person who's COVID positive or symptomatic with COVID-associated symptoms, whether they have COVID-associated symptoms, whether they've been asked to quarantine or test by a healthcare provider. And I acknowledge that those questions are more restrictive than current CDC guidance for people who have been fully vaccinated. And the reason that we're doing it is because we're not currently able, or it's not currently recommended to ask people about their vaccine status. So without being able to ask them about their vaccine status, we just want to make sure we're treating everyone equitably and providing the same services to everyone regardless of vaccination. So we will continue to be a little bit more restrictive than CDC guidance. At least I'm going to plan through May and June, and then as we get more guidance on how we can incorporate vaccine status into programming, that may evolve in future months. But that is my plan for now, for May and June, again, for those equity and safety reasons. I did put that right on the front page of the newsletter, hopeful that people will see and understand that protocol. So we are still asking that very extensive list of questions and enforcing how those answers impact program access. So I just wanted to mention that. And then we are working through actively our resumption in on-site programming. It, of course, has health, safety, liability concerns, capacity concerns. And it's also an opportunity for us to evaluate programs that we just kind of took for granted. We've done it before, so we'll continue doing it. And this is a chance to come at it with fresh eyes and decide if it's still, meeting a need or want of the community. So we're in the process of doing that now. Tentative target for July to resume some small group on-site programming, potentially some outdoor programming. And we'll just continue to publicize updates on what that scale up looks like. I don't know if anyone has any questions of that. I know I'm talking a lot and I apologize.
No, it's great. I think, it certainly the job isn't made any easier by the conflict in COVID instructions and so forth. Personally, I'd like to see everybody that's been vaccinated have a V tattooed on their forehead, but it ought to be. I'm of the opinion that if you've been vaccinated thoroughly and been the 2 weeks, if you can't give it and you can't get it, what is the problem? So I believe in the vaccine. Because I'm one of those people, but I know the conflicting reports out of CDC and various health professionals, are very conflicting and very hard to follow. So, yeah, I think you're doing a great job with it. I think you're doing the best you can. It's just very hard to interpret and go forward with it. So I think you're doing a great job, Emily. So thank you.
I appreciate that. All right, so I mentioned at our April meeting that we have received the new leased vehicle from Cape Cod Regional Transit Authority. Unfortunately, that lease agreement has not yet been signed. It did go through administration, was vetted by our town council. They have recommended some language changes, so I'll be sending it back to CCRTA for their review. So that vehicle can't be operated until we have a signed lease agreement. So hopefully that will be finalized soon, and I will certainly keep you updated on the status of that agreement. And then I think very lastly, in terms of our volunteer needs, I had mentioned at our meeting last month that we were looking to onboard additional reception volunteers. I'm very excited to report that 2 new volunteers started this week. One is someone who returned. She was a pre-COVID volunteer and is now rejoining our reception ranks. And then we have another new volunteer who is starting just this morning. We would love to bring on 1 additional volunteer for reception coverage, especially as we're looking at scaling up. We just really need that support as kind of folks first come on in and check in and participate in programs. So if you know of anyone who would like to work, 3 or 6 hours a week with us here, we would love to hear from them. And then lastly, we are also hoping to onboard maybe 1 more lunch driver. We've had some folks who are going to be taking a temporary pause. They have summer plans or travel plans or other commitments that are coming back into their lives. So we would love to bring on 1 more driver. Again, this program may be winding down soon, but while it's still operational at this capacity, we'd love to have 1 more regular driver. And again, those are 60 to 90-minute shifts. And once or twice per week is what we're hoping for a lunch driver. So I think that concludes my report, although I'm happy to, answer any questions or provide other feedback.
Okay, anybody got any comments they want to make?
We appreciate
Nobody?
it.
We appreciate what you're doing.
Thank you.
Okay, I guess everyone is more than happy to go. Nobody's got anything bad to say. Are you having any complaints or difficulties with the transportation issues that we've had in the past?
We're really not. I'll say, with having only 1 or 2 riders at a time, we have been more flexible. It's not that we necessarily have to go to Shaw's every Tuesday afternoon.
Right.
If we're only responding to the needs of 1 or 2 people, we have more flexibility. We'll have to, incorporate more of a defined schedule as we increase capacity. But I think people have appreciated the flexibility that our lower capacity has provided.
Okay, so you haven't had no issues that have reared their ugly heads like last time.
Right.
Okay.
Which has been nice, yes.
Yes, I'm sure. Okay. Okay, I guess the next would be Elder Services. We have anything to report on that front other than, I guess Richard was going to address that more in depth. So I get maybe table that for the time being.
Joanne,
Unless anyone
I
else-
know you had asked and graciously accepted to extend your tenure by a month. I don't know if you wanted to speak to that now.
Oh, yes, the annual meeting is May 25th, and the director asked me if I would stay on through that, and I consented to do that.
Thank you, Joanne. That's wonderful.
Thanks, Joanne.
Allow us a little more time to fill that huge hole. So anyhow, anybody attempted to volunteer? Silence is deafening. Okay.
Thank you.
All right. Well, unless we have anything else, anyone want to say anything?
Oh, I do have a report from Elder Services, the
Oh,
meeting.
good. Oh, please, Joanne, go ahead. I'm sorry.
They did have a financial report, which they do at the beginning of every meeting. And the nutrition, the new vendor for the Meals on Wheels, they're working out the kinks. In general, it's been a vast improvement. Some people prefer the past caterer, but most are very happy with the new vendor, especially when one day they received a meal with shrimp.
Oh, nice.
They were very happy. And clinical services that continue with in-person visits, they're pushing to see all consumers in person rather than remote. They can do more in person to meet consumer needs. On the advisory council, the new grants applications will be going out. They published a legal notice in May, and letters of intent are sent out, I guess, the 10th. Proposals have to be in by July 26th. That's when we could apply for grants. Emily, I don't know if they've sent anything out yet on that.
Actually, just yesterday, they mentioned a meeting to discuss the grant process, so I should know more soon as well.
Okay, and Elder Service has received some federal grants that they're going to be distributed to all COAs out of the amount of $1,200 for a project that they might want to do. I don't know if you've heard that yet, Emily. Let's see. They had several COVID cases with Elder Services, their employees. 3 of them went out to dinner together and had the COVID. Not, they were quarantined, but they weren't, really sick or anything. And it was stated that we are the highest in the country for the Brazilian strain. Now I'm wondering, is it Cape Cod or all of Massachusetts? Should have asked on that. They're continuing helping with vaccinations for their consumers. And that's the report.
Okay, thank you, Joanne. Very
Okay.
good. Excellent. Okay, is there anything else?
Yes, I am very, very disturbed with the town administrator. I feel he has let the Council on Aging down. He's let our qualified director, who wants qualified people in her department, and he has just kind of pushed it aside. I'm very angry at him, very angry.
Yeah, I'm very disappointed in it myself. You know, I think Emily's done a fantastic job, and certainly
Yeah.
she is the best source of what her needs are. And she presented a beautiful program. I mean, very well done. I don't know how he could have not turned his back, turned that down. I really don't.
I just let that council on aging down. That's how I feel.
Yeah, I tend to agree with you on that, Joanne. It was a very comprehensive, well thought out reorganization plan, and I think
It
very
is.
disappointing.
Right.
So, especially when it wasn't going to cost any money. You know,
It's
that
unbelievable.
I know it really is. I feel badly about it myself. Okay.
One more thing.
Yes.
I understand it's Emily's birthday today. Is that right?
Really?
I know
Saturday,
a
usually.
very happy birthday.
Well, happy birthday, Emily.
Happy birthday.
Cinco de
Happy
Mayo, huh? Okay.
Yeah, so if I see you on Saturday, it'll be a celebratory day.
Absolutely, absolutely. Get that budget passed. Absolutely. Okay. Angie, got anything?
No, everything's fine. And thank you, Emily and Joanne, Carol, and everybody on board. Thank you.
Okay. And what about you, Ralph?
I have nothing except happy birthday, Emily.
Thank you.
And Jim?
Happy birthday, Emily.
Okay.
Thank you.
And I certainly say happy birthday, Emily. Many happy
Thank
returns.
you.
Okay. If there's no further business, could I have a motion to adjourn?
Motion to adjourn.
Second?
I'll second it. Jim.
Okay, all those in favor?
Aye.
Bye.
Aye.
Show of hands?
Aye.
Okay. Aye. Okay. Thank you, Emily.
Thank
I
you
think
all
we're
very
adjourned.
much. I appreciate it.
No problem.
Bye-bye.
Have a nice